Hi, and welcome back to the second hour of Focal Point on AFR Talk, this Thursday edition of Focal Point. Great to have you in the conversation. I just want to remind you again about the buttons we've got available, the Easter buttons available at afastore.net. And also to remind you about the Heart Cry for Revival Conference. You register by March 1st. Which is tomorrow. You can get a $40 discount. Heart Cry for Revival Conference is going to be held at the Billy Graham Training Center at the Cove in Asheville, North Carolina. If you are concerned about revival, you want to meet with other spiritual leaders that are concerned about revival, you want to strategize with other spiritual leaders about revival truths and how we can bring revival to America, you're going to want to be a part of this. It'll take place April 22 through 25, so go to heartcryforrevival.org for more information. You know, one of the things we've tracked here at Focal Point is what's going on with J.C. Penney's, and as you are aware, we encouraged our folks to boycott J.C. Penney because they hired Ellen DeGeneres as their spokeswoman, and she's open, out, proud, avowed lesbian. And we complained about that. J.C. Penney struck back by saying, hey, she represents our values. This is who J.C. Penney is. We are now all about sexual deviancy. We want to have spokesmen. We are about people who engage in sexually abnormal behavior. We want them to represent we want them to be the face of J.C. Penney. Well, I got a story here. Associated Press, shares of J.C. Penney company plunged a day after the department store chain reported massive losses and a nearly 30% drop in revenue in its fiscal fourth quarter period. The results, which were much worse than Wall Street expected, cap off a full year of steep losses. What happened a year ago? That's when they hired Ellen DeGeneres to be their spokesman. And for the last year, they have been in a precipitous free fall, steep losses, and sales drops. So that's all happened in the course of the last year. Might serve as a warning to other businesses that are inclined to go down the same path. Now, we were talking about health care with the last caller, health care for the senior citizens. We talked about the fact that over in the government-run health care system in the UK, you've got older people that are being abandoned by the truckload. They've got an incentive program. We've talked about this before. I won't belabor, but they've got an incentive program, the hospitals there do, to put elderly patients on what's called the Liverpool care pathway. This is a death way. It's not a care pathway. It's a death way. So what they do is if the doctor, the medical team decides that an elderly patient cannot survive, they put them on this Liverpool care pathway. There's no care involved. All they withhold food from them. They withhold nutrition from them. They withhold water. There's no hydration. There's no food. And they die in a matter of days. The average length of life after they're put on this pathway is about 3-4 days. You know, you can go for a long time without food. You can't go more than 3 or 4 days without water. And so they just literally dehydrate these elderly patients to death. And they get a bonus. The more people they stick on this Liverpool care pathway, the more money the hospital gets, because it saves money for the government because they don't have to pay for the care for these senior citizens because they're dead. And their families don't know anything about it. A lot of times their families will find out about it. They'll find a loved one dead on a gurney in a hallway, just left out there and virtually abandoned. They go to the hospital. I want to visit my grandmother. Where is she? We don't know. We can't find her. We lost track of her. They walk around the hospital, and there she is, dead on a cot in the hallway. So, ladies and gentlemen, that's coming with Obamacare. I mean, you look at what government-run health care does in the UK, that's what we're going to experience right here in the United States. Now, not only that, but here's Senator Jeff Sessions, and he had the Government Accountability Office run some numbers on the impact of Obamacare on the federal deficit. Remember, the way Obama sold this to us over and over again, this will bend the cost curve downward. This is going to reduce the cost of health care. You're going to save $2,500 on your health insurance premiums, and we find out instead already they've gone up by $3,000. I got some tweets here from Donna Brazil. She's a big-time Democrat strategist. She says, man, my health care premium went up, and I've got no idea what happened. See if I can find that. Donna Brazil, here's her tweet from yesterday. What's on your menu? Just got off the phone with my health care provider asking them to explain why my premium jumped up. No good answer. So Donna Brazil's so upset about it. Her premiums have taken a spike. She wants answers, and the answer is Obamacare, Donna. This is your guy. This is your Messiah. He's the one that has done this to you. So anyway, Senator Sessions goes to the Government Accountability Office. I want you to run some numbers for me, talk about the financial impact of Obamacare, and here's what came back. Let's listen.
The big government crowd in Washington manipulated the numbers in order to get the financial score they wanted, in order to get their bill passed, and to increase power and influence. The goal was not truth or financial responsibility, but to pass the bill. And this is how a country goes broke. It's also how the economy and jobs are destroyed.
And what Sessions was talking about, he's got this report in front of him, and according to the GAO, Obamacare will increase the long-term federal deficit by $6.2 trillion. That's going to be the net impact of Obamacare on our deficit. It's going to add $6.2 trillion to our national deficit, and it's going to make health care worse. Less access, fewer doctors, fewer services, longer waits, all that, plus it's going to add a cool $6.2 trillion to the federal deficit. And remember Barack Obama back in 2009, I will not sign a plan that adds one dime to our deficits. Well, he didn't. This plan didn't add a dime to the deficit. It's adding $6.2 trillion to the deficit. Now, here is the founder of Subway. I want you to listen to this guy. This is clip number 7. This is Fred DeLuca. He's the founder of Subway. And he says an amazing thing. Look, if I was starting all over and I wanted to start Subway today, couldn't do it. Let's listen.
Do you think that the environment for those that are chasing the American dream by setting up their own business has got worse or better in those 13 years?
Oh, it's continuously gotten worse because there's more and more regulations, and it's tough for people to get into business, especially a small business. I'll tell you, if I started Subway today, Subway would not exist.
Subway would not exist. He started it in the 60s. There wasn't as much regulation, wasn't much red tape. In fact, he said one of the major contributors was a possible increase in the minimum wage. That's going to make it difficult to do a startup. The end of the payroll tax holiday, so everybody's taxes went up 2% January. That's going to make it tough. People have less disposable income. And the Affordable Care Act, Obamacare. And he said, look, the biggest concern that my franchisees have right now is Obamacare. That is the biggest concern that we have. And remember, Subway employs a lot of part-time people. So I'm sure they're one of the companies that's out there trying to figure out how they can keep everybody at 29 hours a week or below so they don't have to pay penalties for not providing the kind of Obamacare, the kind of care that Obama insists everybody provide. Focal Point, AFR Talk, back in 2.